Today on Dueling Doctors, it's our Not Again show. We're talking about three very common health issues that seem to pop up at least once a year. And when they do, they have us saying, not again. We're talking about pimples, the common cold, and yeast infections. What causes these persistent problems and how should we treat them? Different doctors from the world of holistic natural and conventional Western medicine will face off to answer that question. Dueling Doctors begins right now.
It's holistic and natural versus conventional health experts with different opinions and one goal, to help you live a healthier life. Dueling Doctors.
Hi, I'm Dr. Frank Spinelli. Each week on Dueling Doctors, experts from the world of conventional Western and natural holistic medicine come together to discuss the best ways to treat common health concerns. Let's get started by introducing our guests. On one side, we have naturopath and beauty expert, Dr. Karuna Subnani. And on the Western side, we have ear, nose, and throat specialist, Dr. Nalish Patel. Welcome, both of you.
Thank you.
Well, let's get started. Our first topic, pimples. They always seem to pop up at the worst possible time, and when they do, it can leave you feeling like a teenager again, and not in a good way. Adult acne is a skin condition that occurs when your hair follicle becomes plugged with oil and dead skin. Acne most commonly appears on your face, neck, chest, back, and shoulders. Acne can be distressing and annoyingly persistent. Adult acne can be triggered by a hormone imbalance, certain medication, and a diet rich in dairy and carbohydrates. So how can we treat them? Each of our doctors has up to 1 minute to present a treatment plan, and then each will have this chance to respond. We flipped a coin before the show to see who would go first, and Dr. Subnani, you're up first. So, not just for teenagers, adults can get acne too. What is your approach to someone that comes in and says, I'm breaking out and it's embarrassing?
Well, first, we always rule out the hormonal complaints like you were talking about. So, we look for those and, balance the hormones in natural ways. But regardless of whether there's a hormonal imbalance, we want to make sure that the diet is cleared up. So, since I practice Ayurvedic medicine as well, we're taking out those pungent and sour foods to start with.
So, yeah, what is a pungent and sour food?
Yeah, so I'll just give you a few examples.
Sure.
There's a lot of them, but some of the most obvious ones would be peppers.
So any kind of peppers?
Anyone
in particular?
I would say black and cayenne specifically. There's a little bit more, the spicy foods, all the spicy foods. Red wine is a little bit of a culprit. Yeah, all alcohol is pretty heating and pungent, but red wine seems to aggravate people more.
Okay.
Pineapple.
Pineapple?
Yeah, you think about it, when you eat pineapple, you get those sores on the side of your mouth if you eat too many.
Is it just the sugar content in pineapple?
They're more sour and it's more pungent. And strawberries as well. The other key thing is elimination. You want to make sure of really good elimination. You don't want to be constipated, which means
so having a bowel movement,
at least one a day.
Okay,
yeah.
At least once a day.
And a great easy tip for that I give to all my patients, not just the ones that have pimples, is to have a glass or 3 of hot water in the morning.
So drinking, not warm water, right?
Hot water.
Hot water.
Yeah.
So like boiling water?
Boil water in the kettle, have a glass or 3. It helps with elimination, helps with hydration.
So if you don't go to the bathroom every day, if you don't poop every day, it can leave you prone to pimples.
Yes, and so you want to make sure you lighten up your diet if that's an issue too. So less of those heavy foods like you were talking about, dairy, the heavy carbohydrates, a lot of meat, fried food. You have to cut that completely out of your diet if you have any type of acne.
Is it true what my mother used to say when I was a kid, stay away from chocolate, stay away from fried food? Is it really true, or is it really dairy and carbohydrates?
It's all of those.
It is.
It's all of those. And you want to have a diet that matches what's going on for you. So if you do have a constipation issue, you want to make sure that you help with
Any home remedies, things you can do at home that can help me with that zit that I have
Something really easy you could do topically is honey. You just get a good quality honey. And
so just honey right out of your
Don't do it internally because it's pungent internally,
so
but
don't
externally.
Eat the honey. Put some honey right on your finger and put it on spot treatment.
You could do it before bed. It's antibacterial. It dries out the pimple, bring it to a head.
Anything else that you can use that are around the house?
Another one, it's not completely natural, but for those people who use like the white Colgate toothpaste, let's say you're in a hotel room. Yeah, a little bit of that white toothpaste
because it really
works
dries
great.
out the skin as well, so that'll help with the pimple.
Yeah.
So honey and Colgate toothpaste.
Yeah, for topical.
All right, Dr. Patel, someone comes to see you with acne. What is the approach? Usually, you're thinking like this stops when you're a teenager and you grow out of it, but adults get acne too.
Absolutely.
So what would you advise an adult?
Well, I take a very different approach. I think the first thing that I focus on is skincare. So, adults should be, and kids, they should be washing their face twice a day with warm water and a mild soap. If you're a woman and you're using, cosmetics, they should be water-soluble, not, oil-based products.
Because you're clogging pores,
right.
And that's what's getting
exactly.
you acne.
And at the end of the day, the women should wash the makeup off so it's not sitting there all night clogging the pores as well. So prevention is, a key component, but for me it's more skincare based rather than diet. Just mild soap and twice a day. So I think it's more preventative. It'll work for some patients, but it's not the end-all, cure-all. But it's a good basis to start with.
Okay, so after doing just nice hypoallergenic soap and water, what's next? Do you recommend benzoyl peroxidase
right.
or salicylic acid?
So if that's not working, then the common over-the-counter products that you can buy in your pharmacy include products which contain benzoyl peroxide and salicylic acids that you talked
right.
about, and they come in all different forms. Gels, scrubs, washes, so
right.
It really doesn't matter.
And is there any role for oral antibiotics to treating somebody that has acne?
So if that fails, then you should, you may want to go to your doctor, and then absolutely. So there are topical antibiotics that you can use. You can use combination products with benzoyl peroxide, or you can even go on a short course of oral antibiotics, which should be monitored by your doctor.
Right. All right. What do you feel about oral antibiotics for acne?
I think it's a little bit extreme because, as most of us know, you have good and bad bacteria inside of your gut, and if you keep wiping out the bad bacteria for something, let's say, as mild as acne, you may not be able to use those same antibiotics for a more serious infection, because the body does become resistant to the antibiotics. I do agree with Dr. Patel here about the topical routine. It's part of the prevention, same with the internal,
so
and I think all of that should be done
using benzoyl peroxidase
first.
as well, would you recommend that?
Not that aspect of it, just more doing, like a mild,
some mild soap and water. What about the role of oral birth control pills in girls to control acne? I've heard about it.
Yeah, I think it relates back to the fact that we're talking about hormones as a cause of acne. So, if you fail some of the other modalities, that may be something, but that has to be in a select, segment of your population.
Mm-hmm. Any feelings about that?
Well, I do see a lot of girls and older people who have this hormonal acne, and we do more bioidentical hormones, and we do other type of herbs and natural things to balance the hormones before we go to birth control,
what could you use to balance the hormones with herbs?
Well, first we're looking at what the hormonal imbalance
right.
is, okay? So I would give bioidentical progesterone, let's say, rather than using more of a Western-based, progesterone.
Any role like with Vitex?
I was just going to say Vitex is one of the top herbs I would use to naturally bring up the level of progesterone, right. And if that doesn't work, then we'd go to the
All right, and finally, what about Accutane? Any thoughts?
Accutane is used less commonly nowadays than it has because
I still know people who have taken Accutane, right. Even now.
But there have been, many side effects, birth defects, for one, recognized among women of childbearing age, as well as mental issues that can come up with it. So it may be used, but it's less frequently used nowadays.
Definitely a last resort, and probably a no resort for you.
No resort, absolutely not, yeah. Okay. Liver damage, it's not worth it.
Well, we have to take a break. When we come back, something everyone has had to deal with, our nasty friend, the common cold. Welcome back to Dueling Doctors. Today we're taking on things that just keep coming back to haunt us. We discussed pimples before the break, and now it's time to conquer the common cold. A common cold, or acute viral nasopharyngitis, is a contagious viral infectious disease that affects the upper respiratory tract. Symptoms include a sore throat, runny nose, nasal congestion, sneezing, and cough. Colds tend to be mild and self-limiting, lasting no longer than a week. Now you know what it is. We're going to each talk to our doctors to see how we would treat them. Dr. Patel, you're up first.
Very good. I think the most important thing you said, it is caused by a virus. So the tendency to reach for antibiotics is wrong. Okay. So it is a self-limiting disease, and it takes about 7 days to cure it. So basically what you're doing for the patient is helping them get through these 7 days while their body fixes itself. So things you can do, you're basically treating the symptoms.
Yeah. Symptoms,
So
right.
congestion, you can take an oral decongestion such as Sudafed. You can reach for a nasal spray such as Afrin. You can do nasal saline washes, saltwater rinses, take a neti pot you may have heard of.
So neti pot is that we had a device that you just pour into your nose and then you drain the other
Right.
side.
So you're irrigating the nose to wash away the viral
But you're
particles.
using what's in the neti pot?
Warm water and a salt base.
Okay.
So if your body hasn't responded well in 7 days, chances are you may have developed a bacterial infection and it may have progressed to sinusitis, at which case you would want to reach for antibiotics because that's not going to heal
So
itself.
you're looking for fever, possibly, sinus congestion,
Right.
cough, productive cough?
And time is important.
And time.
So duration. By 7 days, a common cold should be drastically improving. If it's not, that means your body is getting infected with the bacteria most likely.
All right. Dr. Subnani, what do you think? Heard a lot of things there, and I was waiting for you to jump in, but you didn't yet.
I
So,
was just
nasal
calculating.
decongestants, Sudafed, Benadryl, what do you make of all that? What is your approach?
So once the body has a cold, the job of the body is to actually get the cold out. So the cold's function is just to get the virus out of the body. So you want to let the cold happen. That's what naturopathic doctors do. We want to actually bring it out. So rather than doing things like, antihistamines or taking Tylenol or all these things which can just suppress the symptoms, we want to actually sometimes enhance the symptoms to bring them out. So a few things you can do are starting out with when you first get the symptoms, have a cup of ginger tea. That's a great thing. Warm up the body, sweat it out, get really bundled up, bring it out. The
Yeah,
second
my mother
thing,
used to make us do that. She would get us,
Or
she'd
hot
have
chicken
tea
soup.
or chicken soup, and she'd make me get in bed and put the sheets up to my neck.
because you want to sweat it
She
out.
wanted me to sweat it out. I thought she was trying to torture me, but I guess not.
Because a virus is just a virus. It's like, why does your immune system actually express the virus?
Okay,
we
so
want to just
ginger
boost the
tea,
immune
you said
system.
first. What's next?
Another thing that's really good is to take vitamin C. You can take about 500 to
Okay.
1,000 milligrams every 2 hours until the cold goes away. You just get that at your health food store. A zinc elderberry losenge is
Zinc,
a really good thing to do. You can just take one every hour, with a little
Right.
bit of food. Vitamin D, depending on if you have a little bit more of a deficiency, you ask your doctor what type to take. But those are some really good natural therapeutics to do.
So what is your feeling about taking a Tylenol for fever? Or, to
we don't want to
bring down
we don't want to bring down the fever. We don't want to stop the nasal congestion. We don't want to do any of that. We want to bring it out. So if a person is suffering with some of those things and they have to go to work, then I would do some of the natural therapeutics I've listed here, maybe some echinacea or some other herbs that we would give to bring it up. But we never want to suppress the
Isn't
symptoms.
that interesting? Because it's just counterintuitive to everything I've been taught was take a Tylenol for fever, maybe take an antihistamine, even though it can make you drowsy and has side effects, to stuff up your nose so you don't have a runny
Because
nose.
none of those things are actually fighting the virus. So if we're actually suppressing the symptoms, then think about it. If you're suppressing the symptoms and then you're going against your body to not rest as much and work more, you're actually more likely then to perhaps get the bacterial infection.
Suppressing the symptoms doesn't inhibit your body from fighting the virus. They're completely separate mechanisms.
But
So
you may then go and function in the world more when you should be resting, which
well, that's
could
a
make
different
the
story.
body worse.
That's I agree. You should rest and you should not spread your germs to others.
Yeah, so those are
but
the
taking
two key
medications
things.
to make you feel better while you're sick doesn't prevent your body from actually getting over the cold. So if you want to feel better, sure, take some of these things. If you don't, you probably will still get better, but you'll live with the runny nose and congestion, and it's not going to prevent you from getting better if you take medication.
Well, there's natural things you can do too.
So yeah, I know, because I think back in the day it was one thing to say you could go to a hospital or you could stay home from work for days, but most people, especially living in major cities, have to get back to work, and I think they treat symptoms by using antihistamines or nasal sprays. And not that I'm saying I condone it or not condone it, but I do find that people feel like they need to function, and I do believe that you can heal with treating symptoms. The last thing I wanted to ask you, what is your feeling on hand sanitizers?
I, especially being a New Yorker, I like to carry around a natural one, not
Like
the.
what would be in
I really like
alcohol-based?
using a lavender. There's EO. There's this brand called EO that has a lavender hand sanitizer. I like it for two reasons. One is it also provides that relaxing effect, which will boost your immune system. And you should always wash your hands. It's a key thing to preventing colds. But if you want to use just a hand sanitizer after you've touched that subway pole or something else, or in any public city where you are, it's a good idea.
Especially in an office. I mean, do you use hand sanitizer at work?
Yeah, I mean, I agree. Prevention is key to this. Not spreading the virus from person to person helps. So
so if you could stay home, that would be great.
Right.
Drink plenty of fluid. Cough in your arm, not in your hand.
Or on a tissue. Always carry
tissue, right?
Away from
sanitizer,
others.
Yes, no, maybe so. I don't know. All right, well, we have to take a break. Coming up next, a little infection that can leave you ladies with a lot of discomfort. We'll be discussing the best ways to treat the dreaded yeast infection next. Welcome back to Dueling Doctors. We're talking about 3 pesky issues that keep showing up way too often and have us saying, not again. Now it's time to discuss our next topic, yeast infections, which occur in 75% of women. Vaginal yeast infections, also called vaginal candidiasis, is very common. As many as 3 out of 4 women experience a yeast infection at some point in their lifetime. Symptoms include vaginal irritation, intense itchiness, and discharge. A yeast infection is not considered a sexually transmitted disease. Now you know what it is. We're going to discuss it. Dr. Subnani, you're up first. Women comes in, presentation is vaginal discharge. What do you say?
So we're going to treat both the local area and the body, because I've seen that many women who have vaginal yeast infections tend to get them often. So we're definitely taking the sugar out of the diet or calming down the amount of sugar that they eat.
So really, how much sugar you consume really can predispose you to recurrent yeast infections.
Absolutely. And we want to reduce the dampness in the body too. So from an Ayurvedic perspective, we don't want a lot of mucus-causing foods, a lot of heavy foods. Back to the elimination, we want to make sure the person's elimination is going really well.
So pooping actually helps your pimples and vaginal discharge.
Pooping helps everything. So we're definitely going to balance the body and see if there's, we're not talking about like a systemic yeast infection, but if there's that, we want to look at maybe some natural herbal antifungals or reduce some probiotics. The digestive tract, we have good.
So what's a natural herbal antifungal?
There's different ones that we use, different blends of Ayurvedic herbs. We're always looking at the whole person, so I wouldn't just throw something very, specific based on the infection. It's more based on the person, like their whole picture.
I mean, could you name like one?
Vidanga is one.
Okay.
That's an Ayurvedic herb that
because
we
what we're hoping for is like somebody could at least go to their doctor and say, I heard that this exists. So
another thing would be to use a really good oral probiotic.
So probiotics, we throw that word around a lot. What's actually in a probiotic?
You have good and bad bacteria in your digestive tract, and so good bacteria in a probiotic, or you see it in live cultures in your yogurt, that's your kefir, you have it in sauerkraut, vinegar-free sauerkraut is another really good place to get it. So you want to have abundance of those like good bacteria. So I'd give a high-dose probiotic, and then also you can use that same probiotic in a capsule and insert it vaginally.
The same one that you take orally,
it's the same one.
Insert vaginally.
And then if you're you don't have time to get that, go to your local grocery store and get a plain yogurt that has live cultures in it, and you can either use a syringe or even use a clean finger and insert the yogurt into the vagina, and it provides a lot of relief.
So the probiotic wrapped in some yogurt, and you can actually put it in your vagina.
You could do one or the other, because remember the yogurt has the live cultures.
That's interesting.
If the yeast infection is severe, we also use either boric acid mixed with a little bit of probiotic, or even a homeopathic boric acid, because ones that are severe are going to need a little bit more care, and you want to do that definitely every night before you go to bed, and some more severe ones would need it morning and night. You also want to practice good hygiene. Like, don't wear like nylon underwear or nylons on a humid day. Don't stay in a wet bathing suit. I mean, you want to keep the vaginal area dry.
So just some hygiene as well as incorporating some dietary changes could really help. But that's really interesting. I didn't know that you could actually use the probiotics orally.
Yeah,
or
the same one, just insert it.
That's
up
interesting.
To the cervix.
All right, Dr. Patel, I was thinking, it seems set and standard antifungal medication out the door, but what else would you be worried about if a woman just came in saying, I have vaginal discharge?
Right, that's a great question. I think one of the problems is many women tend to self-treat vaginal yeast infections.
Because you could buy anything over the counter. You think, okay, this is vaginal discharge. I'm just going to buy some, I don't even know what the product is over the counter, but diflucan. I'm sure you can get some version of, or monostat.
Well, I think the problem here is that the symptoms are not always clear-cut. Studies have shown that women are not good at necessarily identifying a yeast infection. So you don't want to miss other diseases. You know, for example, if you're a diabetic and your sugar's out of control, you can, you know, you
so
may not.
that was what you were saying. If your
Absolutely.
sugars are out of control, it could be a sign that you're pre-diabetic if you're getting recurrent yeast infections. So diabetes is something you'd want to rule
If you're
out.
any sort of immunocompromised state, if your body's not able to, you know, fight a fungal infection, that could be missed if you're self-treating.
Also, pregnancy can present as having discharge, not necessarily, you know, candidiasis, but it could be also something that could be associated with pregnancy.
And also the treatment may be different for pregnant women.
Absolutely
so that's the
different.
other.
But also, I was thinking you'd have to worry about a sexually transmitted disease, not another sexually transmitted, but a sexually transmitted disease, because you could present with discharge. And then what do you recommend when a patient comes in and tells you that she douches a lot? Because I've heard of women doing this. Some women have told me they do it, and they think they would get recurrent yeast infections that way because of what you were saying before about really eliminating the natural flora.
I don't recommend
At all.
douching, the over-the-counter douching at all for vaginal yeast.
Yeah, I think the main point here is that there is a natural balance between good bacteria and a low amount of, you know, fungal elements that have to be preserved. So the other big topic that I see a lot is overuse of antibiotics.
Yeah, absolutely,
So-
which can predispose you.
Absolutely.
All right, well, we have to go. I want to thank you both very much for coming today and sharing your wealth of knowledge. Stick around, we'll be right back. Welcome back to our Not Again show. Adult acne can be embarrassing and annoying. Monitor your diet and reduce sugar and carbohydrates. Wash your face daily with a hypoallergenic cleanser with water. I also recommend using benzoyl peroxidase for recurrent breakouts. For common colds, the best treatment is rest, increased fluids, vitamin C, and a big old bowl of chicken soup, or vegetable soup if you're a vegan. And finally, vaginal yeast infections are common. Preventative measures include avoiding sugar and dairy products and adding a probiotic to your daily regimen. Recurrent infections may be a warning sign of diabetes. Other things to consider include pregnancy and sexually transmitted diseases. I'm Dr. Frank Spinelli. Hope to see you again soon on Dueling Doctors for more healthy discussion as you explore the best path to your own personal prescription. And please be sure to talk to your healthcare provider before making any medical decisions. See you next time.